So first up, we have the panel discussion on telehealth and integrated data management. And it is indeed an honor for me to introduce our renowned contributors. Let me start by introducing our eminent moderator, Mr. Mohammed Kawsar Harun, Electronic Medical Record Specialist, Primary Healthcare Corporation, Mr. Ahmed AlZahrani, Director, Healthcare Technology Development, Ministry of National Guard Health Affairs, Dr. Hala Youssef, Regional Sexual and Reproductive Health Advisor, UNFPA, ASRO, and finally we have Mr. Abdullah Saleem, Group CIO, Omni Hospitals. Over to you, Mr. Mohammed, to moderate this session.
Thank you very much. Good morning, everyone, the organizers, panelists, and attendees. Thank you so much for investing your valuable time for the summit, and it has been a pleasure for me to attend. There have been valuable discussions, keynotes, and panel discussions since yesterday. We've been going through around telehealth technologies. Most of the topics highlighted the theme of this summit, which is experiences and lessons learned from the pandemic. And the discussions emerged the opportunities and challenges in telehealth. I have seen in multiple instances the eminent panelists and speakers refer to McKinsey's report on telehealth, which are so insightful and informative, of course. While browsing through some other reports of McKinsey's, I came across an interesting one quoting, "Patients love telehealth, physicians are not so sure." So physicians say they are concerned about telehealth's long-term sustainability. So I've tried some study and gathering some data behind this report. While going through, it looks like data integration is one of the key elements that plays a vital role underlying and as an underlying factor for the dissatisfaction, or I would say the confusion that our clinicians are having. There are some common challenges in data integration for healthcare systems, as we are aware of, and especially for telehealth, which namely I could say standardized data formats, streaming data from medical devices or the wearables, data privacy and compliance regulations, processing ability, and the health information exchange, and also the users play a factor behind. So let us listen from our expert panelists. I would like to start with Mr. Ahmed AlZahrani to start with his discussion, and I would appreciate if you kindly give us some details, some brief about the importance of data integration, while many of the healthcare facilities are still working on standardizing the data integration or management process. Mr. Ahmed, please. Thank you.
Thank you so much. It's really a pleasure to be with all of you in this summit. I learned a lot from the people in the other sessions, and it was really a very beneficial sessions. And it's helped me also to structure my speech of this important topic. So regarding the data management integration, as I think, as we all know that COVID-19 was the best, let's say, trigger or the expediter of all of the digital transformation for globally, not only in our region. So, and we face this, I mean, across all kind of organization, hospitals, companies, any kind of, I mean, the COVID-19 was a really support we get. This is the best advantage we get from COVID-19, that's supporting us to accelerate all initiatives from digital transformation. And one of the important aspects of digital transformation in healthcare especially is the data management integration, especially that in our region, there was recently start adopting the EMR like 10 years ago or less, even some of the organization. So if we look at it from this perspective, if you go back 10 years back, let's say let's try to imagine that we're gonna go back 10 years from now, like in 2012 or 2013. At that time, most of the, or let's say the data management that we have in the hospital, it's more oriented on specialty. So it's more specialized system like anesthesia data management system, like cardiovascular information system, a back system, radiology information system. So it was driven by specialty. Once EMR starting to be in place in that and be like people realize the importance to have an EMR integrating all of these data management system, then it was like surprise that everybody said that we're gonna have one only kind of system that could have all data, this is the first thought that everybody thought the EMR can do, which is totally wrong. This is not the idea from the EMR. It's not gonna replace the specialized system, even though that we know some of the big companies, they try to replace or to build some kind of module to replace data management system. But the lesson learned for last 10 years, or that we can see from the most leading companies, that the successful that they have is when they integrate their database with other data management system. It's more successful and more appealing for the end user, instead of using one system that cannot do anything, cannot do everything. So this is one of the key important mindset that we should have it in healthcare provider, that we cannot have such a system that could do everything. And that was one of the things that, I mean, listened from a lot of organization. And if you go for any organization, the maturity of the IT, you're gonna see it is the maturity of the integration and interoperability they have. If they are not mature in this aspect, actually they will not be mature as IT infrastructure or IT or sustainable even system from perspective. If, for example, if you put all of your eggs in one basket, like one system, if this system changed, then you are in disaster. But if you invest most of your effort and your investment in making sure that all available system, best of breed you're gonna take, it will be integratable together. This is I would say the best approach that all or the recognized organization we see they are taking. So I hope I don't want to take more time on this point, but I can elaborate more if we.
Thank you, Mr. Ahmed. It's really a very important point you have highlighted. Yes, interoperability and exchange of data in between different systems is really an important factor that obviously some of the organizations mislead with the concept of having an integrated EMR and to forget or just masking the need of interoperability that in the long run obviously will not work. So it's a really very important point you have highlighted. We appreciate that. Let's listen from Mr. Abdullah Saleem now. If you kindly give us some points about the legal or ethical issues that may rise in telemedicine or telehealth, if you have encountered any, or from your professional background. Thank you, Mr. Abdullah.
Thank you for inviting me for this session. And I think Dr. Abdullah and Mr. Ahmed would have already added the perspective of the digitizations and data management and the telehealth perspective. So if we talk about, I'll just talk with I'll stick myself to the subject, what is given the telemedicine, telehealth, and the data integrity. So the telehealth application is definitely, this technology was there 15 years ago, but the adoption was zero. Neither it was being adopted by the doctors nor the patient. But when this pandemic came in picture, and then it has been demanded by the doctors, by the patient. If the doctor is being called to the patient is refusing to come to the hospital, right? And then in that case, this telehealth components accelerated by the healthcare providers, whatever they had, though it was in a very immature perspective, because it was working in a silos rather than working on the top of the health record. So the telehealth has added a lot of value in terms of primary care. In case of primary care, the patient not supposed to go to the hospital, and they can take the virtual consultation and get the treatment. But again, it is not mandatory. The doctor may ask the patient to come and meet in the person and for the treatment if required. Otherwise, it is not mandatory. All the hospitals globally, they have changed their OPD SOPs in terms of the treating the patient in the outpatient perspective. So that is one important thing. Secondly, the telehealth has started playing a major role in the rural area where the patient is supposed to come and travel and come and see the doctor in OPD, which in outpatient as an outpatient, that has also been bridged very well. And in terms of the revenue perspective, healthcare provider, healthcare organizations perspective, they have also agreed, and that the certain amount of top line or bottom line is going to be covered by the virtual consultation. And the second side, if I'm going to come down that if slowly the way it is evolving, and it has been evolved that telemedicine is not earlier, it was a nice to have and nobody was bothering about it. Now the telehealth in the native application like EMR, EHR, it is a must-have feature. Without that feature, that the EMR cannot be implemented across the organization. So that is one part, that the telehealth. And the telehealth, if the data, if it is working on the top of the native data sets, then it is going to add value to the doctors and the patient at the point of care, at the POC level. Otherwise, it will not. And then the consolidation of the data in terms of clinical data I'm talking about, means whether it is coming from the embedded system, if it is coming from by entering the HCPs, healthcare providers like nurses, doctors, technicians, physiotherapists, and dietitians. Those data is consolidated at one place, and if it is not being consolidated, then the quality of healthcare is going to be questioned. It is not going to be met the way it is supposed to be, because if any, for example, any clinical data which is coming from embedded system, let's say like auto analyzer, which is working in the lab, then MRI machine is there, CT scan. So all those data having a lot of values, and is going to give notifications to the doctor at point of care to enable the proper treatment protocol, treatment clinical pathway to start the treatment. Last thing, one thing I would like to add here once again, that telehealth is the component of the native product which cannot be varied. And the data integrity, definitely, if it is not there, then the quality healthcare is not going to deliver. And if the hospital goes for, especially for the Qatar country perspective, HIMSS stage 6, HIMSS stage 7, then if the data integrity is not in place, then this accreditation is impossible to get in. So that's from my side. Over to you, Mr. Kawsar.
Thank you so much, Mr. Abdullah. It's really a very important thing you have brought here in front of our all panelists and dignitaries. Yes, summarized record in front of the clinicians is really very important to understand what case and what is the patient's condition they are dealing with. So especially in telemedicine, when patients are not around, they're from remotely connected, it's very important to have a summarized face sheet in front of the clinicians to understand what is the patient's condition. And as you have again highlighted about the data integrity, of course, in Qatar's perspective, as Dr. Abdullah previously, our keynote speaker has highlighted the NCD programs and other thing. So that's the time we realized actually what is the beauty of having the data integrity. It's something must to have. Once the COVID surged and we had to stop all the physical consultations, we had no other way to reach our chronic patients and to identify who are the patients should be contacted first. So it was a triaging done by the non-clinicians using the clinical data. And that was possible that we had an integrated database. So thanks to God and all the people behind who are the masterminds of setting up this nice integrated system we have here in the public sector in Qatar. Okay, our next panelist is Dr. Hala Youssef. I'm delighted personally to have representation from UNFPA. So let's welcome Dr. Hala. If you kindly give us a brief about the UNFPA's scope in the Arab region to understand for our panelists and the attendees. Thank you.
Okay. Thank you, Mr. Kawsar, for this introduction. Good afternoon or good morning, esteemed panelists and guests. It's a pleasure to be invited in this important discussion on telehealth, representing UNFPA in the Arab region. Telehealth and data management are crucial to UNFPA's mission, which is to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. We are supporting globally and in the region reproductive health care for women and young people in more than 150 countries, and especially for those who are facing life-threatening complications each month and are in need for immediate actions. So we're serving at least 80% of the world's population with those in need. UNFPA supports reliable access to modern contraceptives sufficient to benefit 20 million women a year, as well as training of thousands of health workers to help ensure at least 90% of all childbirth are supervised by skilled attendants with the needed safe birth supplies, and especially in humanitarian settings. Thus, UNFPA supports prevention of gender-based violence, which affects 1 in 3 women, and prevention of teen pregnancies, complications of which are the leading cause of mortality among this age group. To serve those people, we need to have data and support the technical requirements around development, management, and implementation of sexual reproductive health needs and activities, and in humanitarian settings, including commodities, kits, using different digital applications to calculate. So we understand very much that we should not be leaving anyone behind. And for that, we started to use population data to run estimates for needs of reproductive health kits in humanitarian settings using specific applications for that. And this facilitated very much the reach out to such women. And in accelerating our objectives, we wanted to reach 3 transformative results: prevention of maternal death, prevention of unmet need for family planning, and end GBV. And we're working hard with the Arab governments and partners through technology to strengthen health systems, train different workers, especially, of course, in the medical field, educate midwives, and improve access to full range of reproductive health knowledge and services. We support also different data collection methods like censuses, surveys, and this needs specific new technologies and apps. And of course, COVID-19 has been the catalyst to shift from regular methods to innovation and use of the digital platforms and data through technology with other UN agencies. So there is a lot to support UNFPA's work through telehealth, and more to come as we speak and with the group. Thank you.
Thank you, Dr. Hala. It's really informative and insightful. We appreciate your presence. Would you appreciate if you kindly put some examples of the use of telehealth that you mostly during the pandemic time you've been starting with, and how in the future it could be expanded?
Yes, let me speak about how is UNFPA using telehealth. We're using it to address our challenges. So we have geographical accessibility to women, especially with the humanitarian settings where are some political unrest, disasters, wars, and climate change to come. So telehealth and the digital world will help us very well reach the unreached and see the invisible. So this is one thing. The other is the workforce capacity building, and especially physicians, primary health care, nurses, and midwives. We have developed a smartphone safe delivery app to be used for training purpose of health providers, including midwives on health issues, antenatal care, eclampsia, post-abortion care, family planning, and spacing. It can be used by health workers, midwives, remotely for training and sharing information for women and families on sexual reproductive health. It's free and works offline, doesn't need internet access, and follows the WHO global guidelines. So this app is available in 3 languages, English, Arabic, and French, and the Arabic is currently ready for piloting in our region, and then it's launched. We also have the challenge of cultural barriers in reaching the most in need. And we need to give the people repeated proper knowledge and information and specific groups. So UNFPA is also in process of finalizing a disability mobile phone application that helps disabled women and young people to get the knowledge related to sexual reproductive health and where to access services. It includes topics of family planning, birth spacing, puberty, pregnancy, nutrition, and others. So we have 2 modules that were developed, one for the blind and other for deaf young people. It was tested but working on Android phone only, so we are updating it to be used through the Apple software as well. We also have the challenge of poverty that deepens inequalities, and telehealth can help equitable services and outreach to people. So digital referral should be explored for evidence-based results, especially in primary health care. So these are some examples of what UNFPA is doing using telehealth, and I think this will be promoted to better situation of women and girls. Thank you.
Excellent, excellent. Thank you, Dr. Hala. It's really a very important information for all of us. And thank you so much. We appreciate your presence and the insight of the programs being developed by UNFPA. So we will go back to our panelist, Dr. Ahmed, again, with some more technical issues. If he can highlight, Dr. Ahmed, Mr. Ahmed, please, what would be the main drivers to efficiently adopt or utilize telehealth? If you kindly elaborate on this, the main drivers to continue, I would say, the telehealth. Thank you.
Great. Thank you so much for this question. So actually, we go back like in 2020 during the COVID. So the main driver to adopt all of these kind of technology, including telehealth, was the public health crisis, which is how to make sure that our patients safe, how make sure that the community safe, even how we can make sure that the care provider who exposed to this kind of risks will be also safe. So this was the main driver that accelerates all of these kind of initiatives and emerging technologies. But if we're gonna look at it from sustainable perspective, that what will be also now, because what I can see at that time, why people was not utilizing telehealth, why it's already, since long time, as Mr. Abdullah mentioned, that the video conferencing was there. There is some kind of application using telemedicine was there. But I think from my point of view that the awareness of the telehealth was not really being exposed to all stakeholders. So the COVID, what actually happened during COVID, patient knows what was the benefit to having telehealth. End user knows how to do it. all the people, all stakeholders that already involved in the care or in the healthcare system, they're already exposed to this kind of issues, and everybody knows that, okay, this is the right solution to do it. But the challenge now is how can we make it sustainable? How can we benefit more? So this will tell us to let's say, or it will drive us to see what kind of drivers that will make it sustainable for us. So actually, I think the most important driver of this is the patient safety. And that was the main trigger from the thing. So if you look at it from perspective that Dr. Hala, she mentioned, for data collections and data management. And as we know now, the data is really very important aspect now for the patient safety, because you cannot give the patient the right diagnosis or the right treatment plan, collected data. And you cannot get all of the collected data if you don't have data management integration and some kind of application which allow you for the telehealth. So this is one of the things that was really could be a main driver for this, is how to improve the patient safety by utilizing the telehealth application. And you can look at it not only from the outreach or reaching the patient as the outpatient setting, also inside the hospital. And I can share some kind of example that happened, that was, as I mentioned, the patient safety. Not only the patient safety, sorry, I'm talking the safety as in general. So we've been contacted. We need to try to minimize the exposure of the care provider, especially, you know, they get really exposed to a lot of patients. Their mental health was already as well, it has been treated well. So we try to help them and somehow even inside the hospital setting. So that kind of challenge that we face, it was a trigger for all stakeholders I mentioned to find a solution for the end user by the capability inside the hospital. So what we found, we said, how can we minimize the exposure of the end user or the care provider to the ICU setting, for example, patient, the COVID patient, without compromising the patient care. So we have to balance it in this way. Actually, we just try to connect the tools that we have. So we have the EMR there. So we said, okay, this is a good tool to have it. The medical device integration, we should make it available in the EMR so the end user cannot, or the care provider will not be needed to go inside the patient room to write down the blood pressure or write down the heart rate or the ventilator modes or whatever. So that was also trigger. Even more like the infusion pump. So the setting of the infusion pump to know when we need to change the medication. So vendors also exposed to these kind of issues and help us to have like a web page that we can monitor all of the infusion pump inside the room, and when we need to go inside and change the medication, instead of just keep going inside and outside and then expose the care provider for this kind of risk. So this is, I would say, the main driver was the safety aspect from all stakeholders in the healthcare system. And also I would say now the people see how it's easy and affordable and accessible to have this kind of application in telehealth. So not only that, you can also capitalize on it. You can build on it. It is a great platform for more innovation. It's not only a way that you're going to take it and you continue with it for the next 5 years. You're going to take it and you could innovate. You could have a good feedback with the companies. They could develop with you. You could have win-win solution with them to engage. So this is, I mean, from a telehealth perspective, this is, I mean, a good, let's say, factor for as a driver for them. It's, we have a solution that is accessible, easy to use. All of our new how to use the technology. So why to not really continue using it and make it sustainable? Especially as I mentioned, when we can build on it. And I remember one of the companies when I met with them, they really, instead of just using the telehealth as a video conferencing and consulting the doctor, which is good as well, that you save the patient of traveling, you have easy accessibility, you have all of these things, but they add on it as well, as Dr. Hala mentioned, how can we collect this data in structure format? So they introduce some kind of thing, they call it the digital assistant, like Siri or this kind of application. So this digital assistant role was to monitor the discussion between the physician and the patient, and using the natural language process as one of the AI emerging technology that they are using now, and try to get this kind of discussion and structure it and put it as a data, which is going to help both physician and the patient to save this data and to go back on it or to save it somehow in the patient file. So this is in general, I mean, some kind of drivers that I hope that I highlighted.
This is very useful information, Mr. Ahmed, and you highlighted the driver. Yes, of course, all of our aim is to, first thing is the patient safety and the improved care. Obviously, telehealth is one of the components. We started using it, though it's available since long, but pandemic forced us or drive us to use it. But it's patient safety first. That is the main driver. Will keep this system sustained. And I will go to Mr. Abdullah just again on the continuation of post-pandemic situation, how we are going to sustain with this telehealth. What is your insight about this?
As I said earlier, that there is no choice to avoid the telehealth component as a must-have feature, which is going to enable the patients to be connected with the hospital, with the doctor, and the patient engagement and continuity of the care without telehealth application is impossible. Let me give you an example. Telehealth has taken to the next level now. Like telehealth, suppose the patient is, whether is inpatient, outpatient, or in the community care. So I'm giving an example that especially for the in India, especially the rural places where the chronic patients are number of chronic patients is too much, and it is very tough for them to visiting the hospital again and again, and where this telehealth has played a major role, where wearable devices has been given to the patient, which takes 8 to 10 types of important vitals apart from the regular vitals. For example, it takes the ECG, it takes the SPO, it takes your heart rhythm and heart rate, and it takes your blood sugar testing, and it is connected to your apps, and in case of any abnormal values, it sends the notifications to the treating doctor and team to, and based on that, the doctor approach the patient and then talk to the patient or patient party, and then start giving the treatment at the hospital, at the home, or at the bring them to a hospital and start to bring them treatment. And especially this is in the heart failure perspective patients, adding a lot of values. So this culture is going, telehealth culture is going to be it will be going to be on a next level, whereby it is going to minimize the clinicians' time in terms of virtual consultations, and only the needed people are supposed to come to the hospital, which and to manage them if they are critical. Otherwise, it is the telehealth is going to help them manage the patient at the home. And suppose if it is going to be your suppose for God's sake should not happen, if the same pandemic is going to come, then we and Omni hospital we introduce the hotel quarantine, home quarantine, and then with the help of the telehealth application, we are managing the patient. Out of 100 patients, only 20% we were hospitalizing, 80% patients were being discharged from the hotel and from the home, and they were being cured. So having said that, the new technology which has come in terms of the IoT perspective, the telehealth which has been made on the top IoT technology, it is going to enable in the more flexibility and minimizing the a bit of, not completely, a bit of interaction and manual interactions by the healthcare providers to treat the patient, especially for the community health, primary health, and of course all those data which is going to be consolidated at any given point of time for that hospital where the patient is going to treat. And then if the patient come back again into the hospital for the secondary care, then all those data which has been clinically, which has been consolidated, will be available. And then based on the current encounter and episode of the diagnostic, the clinical pathway, clinical treatment protocol will be enabled to treat the patient. Both it be working for the quantity and primary and the secondary care. Over to you.
Thank you so much. Thank you all for your insightful thoughts and sharing the experiences and knowledge with us in this panel. Yes, we are optimistic that telehealth will continue. It will add value for our patients, for their safety, and for the continuity and improvement in the care process. There are teams of enthusiastic people who work behind for data integration, who work behind to innovate the technologies, and there are a lot of opportunities to get more innovative solutions. And we are hopeful to see more innovation in the future, and we are hopeful that it sustains and overall the quality of patient care is improved with the help of technologies. There is no alternative of getting an integrated data model in the care process, and there is no alternative of having structured data so that in any pandemic or any situation like that, we can come up and reach to our patients who need support and who can be supported even remotely in situations like that. I will go over to Roger if there is any question from the delegates to our honorable panelists.
Currently, no questions at the moment, but in case if there are any questions, we will go ahead and send them across so that they can be answered.
Thank you so much. Is there anything from Dr. Hala to our panelists from healthcare perspective? Because we have actually the scope of UNFPA. So if you have anything specific to our healthcare specialists.
So I can just conclude a very important message that telehealth and data management are tools to reach the people and to make them the best benefit of all, reach with health services, information that they need, and specifically it should be timely that we need this approach. So these are innovative approaches to reach everyone timely, and achievement here is a key. Telehealth is assisting us. We are moving it forwards, and we have to continue for the benefit of people. That's all. Thank you.
Thank you all, and thanks for attending. We hope a better innovative solution keep coming in the future for the safety of our population, for the safety of our nation. And of course, the patient safety is the first driver, obviously, we have taken up from this session, and data integrity is a must. Thank you all for attendance.
Thank you.
Thank you very much to all our eminent panel members, Mr. Ahmed, Dr. Hala, Dr. Abdullah, and of course, our panel moderator, Mr. Mohammed, for the interactive and extremely insightful panel discussion around telehealth and integrated data management. Thank you once again for giving us your precious time for the summit, and I hope all of you have a lovely day ahead. Thank you once again.
Thanks.
Thank you.
Humanity, rising to the challenge of a lifetime, but we're not done yet. Better has just begun. Let's make healthcare reach everyone. Let's push this world forward. Because together, we make life better.